Hello everyone, welcome to our channel Mind Myth Momentous, that is M3. If you are new to this channel, please subscribe and hit the bell icon to get the regular notification of all our new uploads. In today's episode of the series Stress, Anxiety and Depression, we will try to understand the topic Response and Effects of Stress on our Body. Too much stress affects our body in a wrong manner. To know it better, let's begin to explore its responses and effects. Let's imagine a situation. You are caught in a traffic and getting late for a very important meeting, watching the minutes tick away. Now what happens in your brain? Your hypothalamus, a tiny control tower in your brain, decides to send out the order, send in the stress hormones. These stress hormones are the same ones that trigger your body's fight or flight response. Your heartbeat increases, your breath quickens, and your muscles are ready for the action. This response is designed to protect your body in an emergency by preparing you to react quickly. It can be good for a specific thing, but when the stress response keeps firing day after day, it could put your health at serious risk. Stress can play a part in problems such as headaches, high blood pressure and heart problems, diabetes, skin condition, asthma, arthritis, depression and anxiety as well. Most of the health and occupational safety organization across the world has declared stress a hazard of the workplace. We will understand about how to help ourselves with our workplace related stress in a coming episode. Before going to the effects of stress of our body, let's understand its response. In the stress response curve, let's consider the curve as performance, that is functional ability versus stress level. Let's divide it in 5 levels as hypostress, some stress, eustress, additional stress and distress. That is, in level 1, hypostress, no or very little stress is seen, as an individual becomes inactive, understimulated, bored, has difficulty focusing, dissatisfaction, depression, apathy, etc. In level 2, there is some stress but not effective to motivate, that is laid back, slightly inactive. In level 3, eustress, it is an optimal level of stress where individuals are motivated, energized, creative, focused, satisfied, means has their peak performance. In level 4, additional stress starts building up on edge, which is mentally or emotionally preoccupied, unavailable, fatigued and strained. Whereas in level 5 distress, it is way too much stress where an individual feels overloaded with crisis, exhaustion, burnout, breakdown, ill health, depression, anger, apathy, frustration, ineffectiveness, low self-esteem, sorrow or pain, panic, anxiety, etc., etc. In general, as the demands increases, the functional ability is pushed to the maximum where for an individual it all starts with rust out, frustration, boredom, under-involvement, and then slowly by choice or force, she starts gaining the momentum, gets stimulated, alert, decisive, creative, effective and reaches to the optimal peak performance. But if that motivation is not kept positive and going, then slowly that efficiency and alertness starts reducing, thereby making it appear as overload. If the person cannot cope up with the stress as positive and takes it as negative stress, then he or she becomes indecisive, irritable, anxious, confused, fatigued, exhausted, burnout, etc. Over a long enough period, this acute or episodic stress turns into chronic stress, where people may develop additional complications of the body and mind. Without treatment, these patients may develop anxiety disorder, heart disease, weight gain, memory disorders, depression, digestive disorders, etc. Let's understand it in a better manner. How stress affects the body will differ from person to person. Learning to recognize symptoms and exploring stress reduction strategies can help a person manage stress and reduce its effect on the body. Stress can affect any or all major systems in the body, as central nervous system, causing headaches, depression, insomnia, or immune system, digestive system, reproductive system, musculoskeletal system, cardiovascular system, endocrine system, respiratory system, etc. Let us look at its effects on all these different systems and the identifiable symptoms that it can produce. Number 1 is central nervous system. In that, headaches, as stress can be a trigger for tension headaches and migraine in some people. About 70% of the people who experience migraine headaches report stress as the trigger. Then depression. Many experts suggest that stress may cause depression. Continual work-related stress can contribute to depression as well. Then insomnia. The hypothalamus is one of the key structures involved in the sleep-wake cycle. During stressful experiences, the body activates the hypothalamic pituitary adrenal axis and the sympathetic nervous system. These systems release hormones that stimulate attention and arousal, causing issues with sleep. People experiencing stress may develop insomnia or have worsening sleep issues. Stress develops weakened immune system. The immune system is essentially the body's defense mechanism. Its job is to protect us from pathogens like viruses, bacteria, or other microorganisms that cause diseases, to keep us healthy as much as possible. Stress may cause decreased immune function. In moments of acute stress, the body prepares for the possibility of injury or infection by activating the immune system, which protects us from outside dangers. If stress becomes persistent, the long-term release of immune factors such as pro-inflammatory cytokines can cause chronic inflammations. Chronic inflammation is a risk factor for diseases such as atherosclerosis. Effects of stress on our digestive system. You can refer about it also in episode 9 of our series Mental Health Matters. Stress affects the interaction between the brain and gut. Some of the changes may affect smooth muscle movements, deep gut sensation, stomach acid secretion, permeability, that is potentially leading to leaky gut syndrome, a proposed gastrointestinal condition, cell reproduction and blood flow in a gut, the intestinal microbiome as well. These changes lead to or exacerbate several digestive problems including irritable bowel syndrome, heartburn, ulcers, and inflammatory bowel disease. People can also experience changes in appetite when they feel stressed. Effects of stress on reproductive system. Stress can affect both the male and female reproductive system, potentially leading to issues with their sexual life and fertility problems. Some people may experience changes in the menstrual cycle due to stress. Periods may stop or become irregular, and premenstrual symptoms can become more severe. Stress also affects our musculoskeletal system. Researchers have identified a link between work-related stress and the development of chronic pain. Monotonous work and lack of social support are possible risk factors for musculoskeletal issues such as lower back pain. Another effect of stress is cardiovascular system issues. During acute stress, the cardiovascular system prepares the body for the fight or flight response. These preparations involve an increase in the heart rate, contraction strength of the heart, release of epinephrine, norepinephrine, and cortisol, blood flow to the major muscle groups. When a person experiences long-term stress, these responses persist and can also lead to inflammation. Chronic stress can lead to high blood pressure, risk of heart attack or stroke, pounding heart, etc. In the effects of stress on our endocrine system, stress can reduce insulin sensitivity. An increase in the hormones epinephrine and cortisol during stress affects the body's response to insulin. High blood sugar level or hyperglycemia is seen when there is lack of enough insulin. Increase in cortisol can also lead to increased fat accumulation in the abdomen. It is also noted that effects of stress might differ between people in good health and those with insulin resistance or obesity. People living with obesity may be more sensitive to the effects of stress on metabolism. Stress has major effect on our respiratory system as well. Some people may experience breathing difficulties during a stressful response. Breathing difficulties such as shortness of breath and rapid breathing can occur with stress and strong emotions. Rapid breathing is more than 60 breaths per minute. Continuously rapid breathing is a sign of a problem. In adult human at rest, any respiratory rate of 12 to 20 per minute is considered clinically normal. Stress does not directly cause asthma attacks, though experts suggest that stress increases the frequency, duration, and severity of symptoms by increasing the extent of the body's inflammatory response to irritants, allergens, and pathogens. Thanks for watching. Please like, comment, share, subscribe our channel Mind Myth Momentous, that is M3. Please don't forget to press the bell icon for notifications of all our new uploads. In the next episode, we will try to understand stress response cycle, as it is very important to complete the response cycle to neutralize our stress feelings and come back to normal. Till then, bye.